So my name is Ola, as Arno introduced. I'm working for University of Oslo, the HISP Center, together with Jørn and other colleagues that are here. So Jørn gave an excellent review of the whole 30 years history. I'll talk a little bit about how we organized globally in the HISP network at the University of Oslo, and then Sora will talk more about the Asia HISP Hub and the Asian groups. So as Jørn mentioned, it started already in 1994. HISP started as a research project. It's now a global big network of 24 HISP groups, really focusing on strengthening health information systems and information systems in general. So we are now called the HISP Center at the University of Oslo. We have about 100 staff there, including many software developers. And as you know, we developed the DHIS2 platform with a team that's distributed across the world, but led from Oslo. The core activities in the HISP network that we support and facilitate is around local innovation, capacity building, and research. And we do this with finance and collaboration from many global health partners. You can see them listed here. I think from the very beginning in 1994, NORAD, the Norwegian Agency for Development, has been our closest partner and been supporting this work and still are. And then you can see many other partners like Global Fund, PEPFAR, Gavi, CDC, UNICEF, Gates Foundation, USAID, and WHO. And we are also a WHO collaborating center focusing on strengthening health information systems and work very closely with WHO on a lot of the recommended ways to implement DHIS2, including this metadata toolkits that we'll talk about later at this conference. So when it comes to DHIS adoption and use around the world right now, there are 89 countries where ministries of health have adopted DHIS2 as their platform for their integrated health information system. And more than 30 of these are in this region. So as we can see on the map, these dark green are the ones that have scaled nationally, and then the lighter green, these are countries that have started to scale up or use it at a kind of subnational level. So it's really growing quickly, and it needs a lot of support, a lot of capacity building, and this is where the HISP groups come in. So we've, as I said, we have 24 HISP groups, including the University of Oslo HISP Center. You can see them all listed on the right. There are 7 in this region organized under this Asia Hub. And then there are 15 groups in Africa organized as HISP Africa. That was a hub that was actually launched formally last week. I just came from a meeting there in Tanzania. And then we also have a group in Latin America. These groups provide DHIS2 expertise, capacity building, technical support, and guidance to governments around the world, and of course, mainly ministries of health, but also increasingly other sectors like education. What's important about these HISP groups is that they are not project-based or short-term. They are really there to stay and offer a long-term, reliable relationship with the governments they support. As Jørn also mentioned, we do a lot of collaboration with local universities around master level courses, PhD courses, and also in-service trainings. And we still do a lot of research on information system strengthening with a big global PhD program with many PhD students from Asia and Africa. A key part of the HISP group approach is to innovate locally, solving local problems, and then to share these innovations with other groups, with other countries, so that we have a very collaborative network. And this network, just like the DHIS2 platform, is supported and funded by many of these global partners that are listed here. And of course, these partners are very active in funding health information system strengthening at the country level. But it can sometimes happen in a bit of a fragmented way. So that's, of course, a known challenge. And I think by working with the HISP groups, HISP groups can help to do this in a more coordinated way when it comes to the DHIS2 projects in countries, and try to align them so that we can all together strengthen the same system and an integrated approach to DHIS2 implementation. What we are seeing is that HISP groups now have become more than just a technical partner for DHIS2. They provide a lot of support on the broader kind of digital transformation processes with governments, and also increasingly support also other tools than the DHIS2 itself. So this is a growing network, both in number of groups and in their capacity to support their governments. So we have a bit of a signing ceremony to do today. We have this year revised the MOU for the HISP network. So all the 24 groups will sign onto the same document, adhering to these values that are listed here, and also some principles for how we operate. So I was in Tanzania last week with 15 groups in Africa. They all signed. And today, the 7 groups in Asia will sign on to the same document. So as you can see, these values are really about collaboration and sharing. As Jørn also talked about, that journey over 30 years has been a very collaborative process and focused on sharing what we learn by solving problems in one country, in one district, are shared with the global community, with other groups, with other countries, so that we can move together and innovate together. Of course, we promote open source solutions. The DHIS platform is completely open source. It's quite generic, but we try to keep developing that platform, enhancing it with local users in mind. So through collaboration with the HISP groups, with all of you in the governments, we try to have a local participatory design process where we can learn your requirements, your specific needs, and turn them into generic features that we can release on the DHIS2 platform through a kind of participatory design process that Jørn also talked about. Through that and all the capacity building in country, we really want to foster and enable local ownership so that governments can take full control and have capacity to maintain and further develop their DHIS2 system in country. And that's where this long-term relationship with the HISP also come in, that they are committed to be there and support you and gradually build capacity so that you have that local ownership. Yes, so I think, as I mentioned, we'll sign the MOU today. So before Saurabh talks about the Asia Hub activities, I'd like all the Asian groups to come on stage and we can quickly sign this document. You can see the signatures from Africa on the right. And here are the values and the principles that we are now signing on to. So we'll do a bit of a signing here and take some photos, and then we move on with the agenda. Thank you.
Actually, I would like to invite all the HISP leads to come on the stage. Okay, so we start from HISP Bangladesh, Mr. Hanan Khan. Yeah. Yeah. Okay. Next, pose for the camera and stand there. Please stand there. Okay. Next, HISP Pakistan, Mr. Adnan. Yes, just stay there, stay there. We'll have a group photo together. Yeah. Photo. Okay, next, our new member, HISP Mina, Mr. Muhammad. Then I request HISP Sri Lanka to come. But before that one, Muhammad pose. Okay. HISP Sri Lanka, Mr. Pamod. And then like we have Mr. Saurabh from HISP India. Then it's me, John Lewis from HISP Vietnam. And we have HISP Indonesia, Ms. Rati. These are all our HISP Asia team. We always aim to work together and collaborate in implementing joint projects between different countries, help each other in different places, because like each and every group has their own strength and also weaknesses, but like, with a collaborative effort, we have very strong team. So we work together across. So we have all the people around here. Last year we were in Sri Lanka. So next year maybe we'll be in Indonesia. So this conference will keep on moving based on where we want to try to organize. Yep, Saurabh.
I have the presentation. Okay. So yeah, so as John mentioned, we all work in a collaborative manner. So we are 7 HIS groups, and HISP India acts as a secretariat, taking care of the administrative responsibilities of managing the hub. So I have a quick slide deck to show the updates and the projects that we're working together. So you'll get to know how we are coordinating and supporting multiple countries in the Asia region for different initiatives.
Thank you.
So as we just mentioned, HISP Asia Hub is a body which comprises of 7 HIS groups in Bangladesh, India, Indonesia, Middle East and North Africa, Pakistan, Sri Lanka and Vietnam. We jointly work together to support the customization and adaptation of DHIS2 to meet the specific needs of the countries in the Asia Pacific region. We have been working on building capacity and technical support to the government health agencies and the partners on DHIS2 implementation and usage. And we are supporting the integration of DHIS2 with other information systems to enhance the interoperability and data exchange in the countries we work for. So the objectives of setting up the HISP Asia Hub was to create a formal network to support the HIS groups in the region for technical and administrative areas, promoting coordination and cooperation activities related to information system strengthening at the country and the regional level, building better collaborations with funding partners in the region, building more cohesive DHIS implementations and support plan for the countries we work in, building shared expertise on DHIS implementation areas such as HMIS needs assessment, country HMIS work planning, budgeting, DHIS technical assistance, and implementation support. We ensure that we work together to give quality delivery of DHIS services in the region, and most importantly, collaborating and working together to share best practices and encourage skill transfer between the HIS groups and the ministries that we support through improved administrative performance and organizational development. Just quick highlights of some of the joint projects that we have done over the last couple of years. So we finished the Global Fund Data SI project at the end of last year, where the HIS groups in the region work together in supporting 6 countries for various DHIS2 technical assistance projects in Afghanistan, Myanmar, Sri Lanka, Pakistan, Bhutan, and Nepal. In total, through 3 years of the project, we were able to accomplish 18 support activities in 7 countries in the region, which included activities like DHIS2 version upgradations, capacity building workshops, implementation of WHO HIV TB malaria dashboards, And we also piloted the health facility profile in a couple of countries. The Global Fund was generous enough to support the last two Asia conferences in Vietnam and Sri Lanka, and they were conducted through their support. We also collaborated with UNFPA, the Asia Pacific Regional Office, where we carried out 7 in-country assessments in Nepal, Maldives, Indonesia, Timor, Bangladesh, Laos, and PNG, understanding their current data collection and data use needs, practices for SRM and CH. And we also organized a webinar series for the UNFPA and the Minister of Health colleagues on DHIS2 analytics, data quality, and data use. And to end this engagement, we organized a DHIS2 data analytics and data quality workshop for Minister of Health and UNFPA staff from 6 countries at the end of last year. These are some of the projects that we're working on currently. We're supporting 6 countries in the region, in the Asia region, working with WHO CERO, and HISP India, HISP Vietnam, HISP Sri Lanka, and HISP Bangladesh are working together to support these countries. We recently collaborated with the Swiss TPH, HISP India, and HISP Vietnam and Indonesia to carry out communicable disease surveillance systems assessment in 3 countries in the region. That is an ongoing project. HISP Vietnam is leading the development of the ICD-11 morbidity reporting app, which is a generic application, could be used by all the countries in the region. So currently that's an ongoing development. And recently, last week, the team from HISP India and Vietnam were in Laos to carry out the DHIS2 majority assessment. And currently, we are analyzing the data which has been collected and will soon submit a report to the Minister of Health and the WHO team. So these were quick updates on the projects that we're working on. Each year, as part of the conference, we also organize the annual HISP Asia Hub meetup. So this year, the annual meetup is on 4th and 5th of October, where we are plan on discussing the work that each of the HIS groups did last year. What were the successes, what were the failures, and what was the lessons learned. Each of the HIS groups will share the local innovations that they've done and how these innovations could be implemented in other countries in the region with minimal modifications. We aim to identify common priorities across the countries and the challenges that the countries are facing with respect to their DHIS implementations and work together to find better solutions for them. And as always, we work towards building joint collaboration support, which can benefit the DHIS implementation country. So this was a quick plan on the annual meetup that is planned after the conference. So that was a quick update on the activities that the HISP Asia Hub has done over the last couple of years and what are planned next. And if there are any questions for any of the HISP groups, they are available for discussions during the coffee break and the lunch breaks. So thank you, everyone, and we look forward to a continued successful sessions. Thank you.
We will have a tea break now, but before that, I would like to invite all of you to go to the foyer for group meeting, please. We go outside in the reception hall. Thank you.